Hello, I'm Juniper Owens, Director of the Academy of Integrative Mental Health, and your host for today's episode. I recently had an engaging and connecting conversation with Robyn Gobbel, who is the host of the Parenting After Trauma podcast, creator of Being With, an immersion course for parenting professionals, and The Club, a virtual community for parents of kids with big, baffling behaviors. Robyn is also the author of Raising Kids with Big Baffling Behaviors, Brain, Body, Sensory Strategies That Really Work, coming in 2023. In this conversation, we talk about interpersonal neurobiology and relational neuroscience, how behavior is an externalization of inner experience, curiosity rather than judgment, connection as a biological imperative, relational neuroscience and substance use disorder, resonance circuitry as an agent of change, co-regulation with nature, and so much more. I learned so much speaking with Robyn and received some co-regulation along the way, and I hope you do too. Let's get to it. All right, Robyn, thank you so much for being here today and sharing your work and your wisdom and just yourself with us and our audience. So excited.
Yeah, me too. Thanks for the invitation and for this time to be relational this morning.
Yes, and I'm excited to learn more about that because I'm actually kind of a newbie in this field. So yeah, if you just want to go ahead and start maybe by introducing yourself to our guest, and then we can move on from there.
I would love that. So I am currently sitting in Grand Rapids, Michigan, where we've lived for, I don't know, like 3.5 years. I did the vast majority of like my clinical work, my professional work, my professional development in Austin, Texas. We relocated from Austin to Grand Rapids about, oh my gosh, I can't believe it. It's been almost 4 years now. And so in Austin, I had a full-time clinical practice, saw clients, one-on-one, 6, 7, 8 hours a day, like a typical therapist. And my area of expertise and kind of what I've always been really driven towards and passionate for is working with kids who have histories of trauma, attachment loss. Most of the kids that I worked with were in adoptive families. And I've worked with their families, not just with kids one-on-one, but with their families. And then, just how practices evolve, slowly over the years, I started seeing more and more adults as well, to the point where I got to be about half and half kids and families and half adults, but same kind of population, right? Like adults where they're just kind of the grown-up versions of the kids that I worked with, had really tough early years, attachment loss, were struggling with relationally and with regulation. Um, and I've always had this part of me that has been a teacher, always, like since high school, really. I was always found myself in roles of being a teacher and discovered that I loved teaching in this field as well, and have been doing that almost really since I felt like I had, I guess, something worth sharing with others. And it's just super passionate about one, reaching as many people as possible in a way that's different than one-on-one work. Breaking down barriers. I think that's such a huge issue in our field, is that we tend to hold so tightly, I think, to our information and our expertise and what we know and understand and how we help people. And so I've always been real passionate about like really just breaking down those barriers and lots more accessibility for folks outside the mental health field. And then of course the community aspect of teaching, like bringing folks together, when I'm teaching is such an extremely valuable piece. So I do a lot of both. I teach parents directly and support parents of kids. What I say now is with vulnerable nervous systems, big baffling behaviors. And then I teach professionals as well, in hope to bring this lens shift for me of interpersonal neurobiology and relational neuroscience that I stumbled upon, I don't know, well over a decade ago now, probably about 2010. That's changed my life. It's changed my life personally. It's changed my life professionally. It's changed everything. I do not know what my life would look like if I wasn't really grounded in the ideas that I've learned through relational neuroscience. And so I just have so much passion to bring that to folks professionally, but also again, just personally and sharing it with, I tend to work most with parents. But the information is applicable to humans. So that's what I do now. Since we've moved to Grand Rapids, Michigan, I thought I would start a clinical practice, but I moved like kind of right before the pandemic. And for a lot of reasons, wasn't super interested in starting a new clinical practice at the onset of the pandemic. So I just kind of kept doing what I was doing virtually with the teaching and the training. And now I do that full time.
Yes. That's exciting, isn't it? Sometimes in your career to have that passion and then find a space where you're like, huh, well, there's time to grow this now. That's what it sounds
Yes.
like. And I really am curious to learn more about interpersonal neurobiology and relational neuroscience. I often hear those kind of terms or phrases or ways of practicing together. So if you could just kind of give a explanation or definition that works for you for
Yeah.
maybe someone that hasn't heard of it, because the more I'm learning, I'm like, well, I think I have understood some of these ideas, but not
Sure.
in that context.
Yes, absolutely. So, interpersonal neurobiology is the field that is was developed by Dr. Dan Siegel. So, lots of your listeners have probably heard of Dr. Siegel in some way. He's written, his kind of textbook, seminal book was The Developing Mind. Mindsight is a book that's read by a lot of clinicians that folks may have heard of. Um, Folks who are parents or work in the parenting world maybe have heard of Parenting from the Inside Out, or his series with Dr. Tina Payne Bryson, which starts with Whole Brain Child and then No Drama Discipline. There's 4 books in that series. So he writes really prolifically, and he coined this term in the field of interpersonal neurobiology. So he's taking, neuroscience and neurobiology studies and research, but applying it very much directly to like the relational, social, behavioral brain, those parts of us, and specifically the interpersonal aspect and how our brains develop and are nurtured, and essentially how we're, very co-regulational, connection-based beings in this interpersonal experience. That it's not the development of, my brain and my nervous system inside myself, but it's the development and the continued development of it interpersonally and relationally. So I discovered his work from I'm actually pretty sure it was in my own EMDR training a million bajillion years ago. And I'd always been really interested in attachment, like attachment theory, attachment research is what I had done in my graduate studies, what I'd been really most interested in. I've always wanted to work with kids who back then we would have diagnosed with reactive attachment disorder. And so the way that Dr. Siegel was conceptualizing and teaching about attachment really landed with me. It made sense to me in a new way. And now when I look back and I think about like, well, why was that? What I would say with my understanding of interpersonal neurobiology now is that he was teaching and does teach about attachment in a very relational, embodied way, as opposed to how I had previously learned about attachment, which was in graduate school, like in this kind of very left brain didactic, like putting it into like categories in a box. It was very linear, right? We had kind of the checklist, and um that is a very fascinating way to learn about attachment, which is, not a linear left brain experience at all. And I think looking back, that's why learning about attachment through his lens and through his language started to feel like, oh my gosh, this thing that has felt so kind of hard for me to latch onto, um, is finally starting to truly make sense. And then I just started to dive a lot deeper. I was working with clients who had behaviors I had never been trained to work with. I had no idea what to do with these completely out of control kids. Not only in my office, they were out of control, but also like their parents were just so desperate for me to help them in their regular life. Like, what do I do when my kid does XYZ? Like things that you're just not taught about when you're training to work with kids and families. I mean, the behaviors were just so, what I would now say, baffling. Like they just made no sense. And I had absolutely no idea what to do. And of course, nobody likes that feeling. I was extremely uncomfortable with this. Like, I have no idea what to do feeling. And I was also extremely uncomfortable with the idea of just referring them out because there was nowhere to refer them to. Like, these parents had already been in multiple therapist offices. They'd already had multiple therapists say, "We don't know how to help you." And it's totally appropriate when you don't know how to help somebody to refer out. Yet, I just didn't want to keep doing that and keep contributing to these families' trauma of having nobody that can help them. So I just started kind of obsessively studying interpersonal neurobiology. I think I had some kind of gut sense that interpersonal neurobiology could help me understand these completely baffling behaviors in a way then that would help me help their parents and help the kids without having to rely on like my own kind of checkbox of when a kid does this, do that. Because that was impossible. Like the behaviors I was seeing, it was like nobody could give me a long enough checklist of when you see this or when a child does this, do that. Like, it would literally be impossible. I think I knew that instinctually. Like I've got to go beyond just what I now call like behavior whack-a-mole and really try to figure out why. And then interpersonal neurobiology at its core absolutely believes that all of us are always working towards the interpersonal neurobiology word is coherence. All of our nervous systems are seeking organization and coherence and regulation. And I'd actually kind of learned the opposite about the kids I was working with. Like people were telling me like these kids want chaos. They want to dominate everybody. They want to be in control. So we have to learn how to take the control away from them. We have to, all these things. And I was just like, this feels really uncomfortable to me. So the idea that like, even though this behavior doesn't make any sense at all, it actually does make sense. Like that was so relieving to me. And I think I just really chased that feeling, devoured everything I could about Dan Siegel, interpersonal neurobiology. He has this concept of the 9 domains of integration that really helped me with treatment planning and understanding where is there a domain of integration that has some impairment? And I won't get into all of it, but it really helps me with, just treatment planning and case conceptualization. And then I started to discover other theorists and other contributors to the field that we would now call relational neuroscience. So like Alan Shore, regulation theory. He talks about regulation theory is really an attachment theory. And that made so much sense to me. And then Dr. Porges's contribution of polyvagal theory and Dr. Bruce Perry's contribution of the neurosequential model of therapeutics. All of these are theories of brain development, nervous system development, and human development, but they are all grounded in the idea that these, nervous system structures, these brain structures develop inside the context of a relational experience. So those then kind of all come together, these, differing theories, but that are grounded in the relational part of the brain and nervous system development kind of come together then to form this broader field now of relational neuroscience. So interpersonal neurobiology is a theory that would be considered a part of relational neuroscience, but it's not the only one. There's a lot of theories that then I kind of bring together to support the way I'm, conceptualizing human behavior and then thinking about how can I support what interpersonal neurobiology calls their integration, knowing that that's kind of the path towards mental wellness.
Mm-hmm. That's a really good explanation as far as that interpersonal neurobiology as a theory, kind of as a foundation. You even said a field of study. So, like, and then we know how each fields of study will draw on different theories and modalities and things like that. So, what struck me as interesting is that, and I think a lot of people are going to relate to what you talked about going out of grad school and then all of a sudden being like supposed to be like helping and these families and you're like, what the hell? I really love that you shared that experience. I think a lot of people are going to resonate. And then you kind of shared that it started to make sense to you when you were really looking at it through this lens. Can you share some of the things that did make started to make sense? So like
Yeah.
maybe a few examples.
Yeah. So I think the pieces of relational neuroscience that really ground and anchor me. One is that behavior is just simply an externalization of inner experience. Those are my words, but that's I've kind of a conclusion that I've come to from what I've learned about relational neuroscience, that even if I have no idea how this behavior could possibly make any sense, it actually does really kind of ground and regulate me to be like, well, I don't know how it's making sense, but I know that it matches something that's happening in their inner experience is matching what we are seeing on the outside. And if I want this thing that's on the outside to change, and sometimes we really do need this behavior that's happening to change because it's dangerous, right? I want to not think about the behavior. I want to think about, but what's driving this behavior? Which more than anything, that helps keep me in this place of curiosity, which is a very, that's a very much in line with the theory of relational neuroscience too, is staying in this place of curiosity. And then the other piece for me that I think really, once I truly understood this, like really shifted the way that I show up with in the world, not just with clients, but I think in the world, was Dr. Porges' polyvagal theory says connection's a biological imperative. We need connection to survive. And there's some other researchers, Bex and Cohen, who have written about what they call the social baseline theory. And what their research says or suggests is that like connection is actually our default. Like we expect connection. It's when we aren't finding connection that our nervous system responds like, uh-oh, there's a problem here. So I was working with kids that were being labeled reactive attachment disorder, right? These kids that everybody was saying they don't want connection. They will do anything in their power to refute connection. And then, kind of at the time, this treatment lens was so we have to figure out a way how to be more, basically have more power than them, be more in control of them. And that's first of all just totally impossible. It's also kind of a gross way to work. Like it was hard for me to show up at work with this idea that like my whole goal was to try to be more in control or more in power. I couldn't it was yucky. And then it also didn't make any sense as I was learning about this relational piece of like connections a biological imperative. But without question, these kids are absolutely behaving in a way that's pushing away connection or very purposefully hurting connection or hurting other people. So it's not like that wasn't real. I mean, that was so I'm like, okay, so how do these things go together? And for no, if for no other reason, the idea that I could kind of rest into, regardless of how totally tragic this child's behavior is, I can rest into the fact that somewhere underneath all of this is a drive for connection. One that it really did allow me to like take a breath and it completely shifted how I showed up at work, which made going to work way better. then, but again, it also kind of brought me back into this place of curiosity of like, well, then what the heck is going on here? Like, why is this child coming at me with, a marker and trying to hurt me? Or why are they saying the most terrible things to their parents? And And if we need connection to survive, why is this child acting as though connection's actually dangerous? So then I went down that rabbit hole and I found a great answer for that in the field of relational neuroscience, that because of their earliest experiences and because of how our attachment circuitry works with our, what I call like our protective danger circuitry, what happens is those two circuitries kind of get tied together when kids, when the developing brain is experiencing danger, terror, life threat, or at the very least, like a lack of safety and co-regulation from the very place that's supposed to be giving them safety, connection, and co-regulation. And when those two experiences get tied together, well, then it makes perfect sense that like connection doesn't bring the same soothing to these kids that it does to, other people who haven't experienced that. Okay, so then again, it really helps me to make sense of things, like to bring the coherence to my own nervous system. So I'm like, okay, now this makes perfect sense. Of course, this child is trying to hurt me. They're actually like the connection that is inevitable inside the therapeutic space, inside the parent-child relationship, right? The connection's inevitable. That's actually causing terror in their nervous system. It's not about this child only wants power and control. It's that power and control help them feel like they're not going to die. That has all these pieces started to make more sense to me. And then, of course, also apply to our adult clients. So our adult clients have the same experiences. They just often express them in slightly different ways. Um, as these things started to make more sense to me, I was able to trust that what I needed to do wasn't come up with some magical solution. What I needed to do was show up in a way that was able to give some connection and safety to their intense dysregulation. Now, that's not easy. Nothing about that is easy, but at least it felt really clear to me.
Absolutely, yes. And I love the way that you weaved that story together as far as your experience of, oh, okay, so this behavior makes sense. And it makes sense to me because you said that some knowing things in a certain way help like with your coherence and your
Yeah.
regulation. And then it was like a light bulb. And I think a lot of people, clinicians that have, and maybe newer clinicians, but I noticed that after people have some years behind their belt, they start to be less interested in that magical intervention. The one
Yes.
thing, if the one
Yep.
worksheet, the
Yep.
one.
Yeah.
And
Yeah.
then
Yeah.
you were like, okay, so really, actually, it's about how I'm showing up. And I think
Yeah.
that is difficult, incredibly difficult work, actually,
Yeah.
way more than learning CBT. Sorry,
Way more.
CBT fans.
Well, no,
But
I mean, there's a time and a place for cognitive strategies without question.
absolutely.
And that, this approach for me also helped me see that like there's nothing wrong with a cognitive intervention. But a lot of us, well, for me, who is working with these kids who have been, just through these most horrifying experiences, we're just using them at the wrong time. And then feeling like there was something wrong with us as a clinician or something wrong with a client because they weren't quote unquote working. So I like to talk about how like we just want to use the right intervention at the right time. And I am a big fan of bulking up your toolbox. I have a very big toolbox full of tools, but it's also exhausting to kind of throw the proverbial spaghetti at the wall, right? And just keep pulling a tool out and chucking it and pulling a tool out. It's exhausting for us. It's exhausting for our clients. It's just a really hard way to practice. But I also think it's an inevitable way of to practice, right? That like we kind of have to go through that stage of development as a clinician I don't think there's really a way to prevent that. And then we get to this place of having a very robust set of tools, but when we use them, like emerges from this deep resonant self-knowing, right? It doesn't even really come from this cognitive place of, oh, I think I should do this tool now. It really just has this sense of like it emerges, allowing us to stay in this very deeply resonant space and also allowing us to stay out of judgment of ourselves or our clients when it doesn't go the way we expect it to go.
Right, right. And let's get into that a little bit because I'm curious about the experience, your experience, like the clinician's experience of, because from what I understand with relational neuroscience, and please correct me if I'm not getting it correct or the way that you understand it, but that like, so the first step is to tune into yourself. What's the experience, what's your experience of what's showing up in session? Is that accurate, or is that something that is done within this practice?
Yeah, definitely. I think that we could easily say the first, like the bowl, the foundation that holds everything is the therapist or the clinicians, because I think this goes way beyond therapy in the mental health field. The professionals and even me in my like relational spaces, but my connection to myself, my presence with myself, my ability to not always be regulated or a perfect holding container by any means, but my ability to be with myself and to be present with myself is kind of like the bowl, like the holding container of everything. Because it's only inside that we can attune to our clients. If I don't know myself, how could I know someone else? Right. And distinguish between you and me and provide them with a mirror without accidentally like tons and tons of projection. I mean, we're going to project. That's not possible to avoid that completely, but to be in more awareness of it when we are. So I absolutely would say yes, like the about most foundational thing. Now that doesn't mean we're constantly in session thinking about ourselves. In fact, it's one of those things that when you get really practiced at, it kind of just runs in the background, right? Like it's like our own just operating system that we have this kind of presence and awareness of ourselves. And it's not necessarily something we're totally paying explicit attention to all the time, but if something kind of rises up that is important and needs our attention, we can give attention to it.
That makes sense. And is what's coming to my mind is a book
Yeah.
that I read a long time ago, The Mindful Therapist. Is that also Siegel? Mindful
Yes.
Therapist.
Yep.
And it talks a lot about building some of those skills. I don't know if that's your favorite resource for that, because I do think it's a different way of interacting. From what I'm learning
Yes.
more about this, it is at least different from me, different than how I was enculturated, different how it was in
For
my
sure.
family, also different from how it was in my formal education program.
Yep.
And so sometimes I even feel like I'm doing something wrong when I'm just kind of
Yeah.
tuning in and just like allowing whatever to show up with my clients, which are mostly adults.
Yeah.
But it is so different. So sometimes I have to kind of override that and be like, no, you're doing good, even though, or not good. That's
Yeah.
one of
Yeah.
my things. I need to know I'm doing good. But
Yeah.
like, as far as the only thing I think was ever supporting that I learned was that like 98% of what happens in session, like that helps people, is the therapeutic relationship or alliance. They
Right.
just didn't tell us what that meant, what
What that
therapeutic relationship,
means.
right?
Exactly. Totally. Then I can bring in folks like Dr. Lou Cozzolino. He writes, I think, really accessible books. Dr. Louis Cozzolino, like um the neuroscience of human relationship. I think he contributes to your rights, like the anthology, How Therapy Works. That Dr. Cozzolino writes a lot about what he calls the resonance circuitry and how we cultivate resonance with our clients and how it is that resonance that is actually the quote unquote agent of change. Right? It is that way that we can stay present and resonant in the face of our clients' intensity and dysregulation, that is what allows their neurobiology and their nervous system to have the opportunity to shift and change and move towards coherence and regulation itself. Now, that's way kind of easy to say, but really hard to do. And some of that is because of the resonance circuitry. Like, we are so easily pulled into and kind of catch our clients' dysregulation in some ways that are really obvious. And it's really easy to see, like, oh my gosh, I am starting to get, as dysregulated as my client. But there's actually so many more ways that it's really not that obvious. And learning the difference between what does it feel like to resonate with my client's experience versus what does it feel like when I'm totally swept away with it, or I'm doing the opposite, like working really hard to not connect with it because it feels so bad, right? And and then to do all of that self-work inside the experience of compassion, like without any judgment towards ourselves. We're not doing anything wrong. We're all just being perfectly, wonderfully, fantastically human. And it is my ability to like resonate with and hold and stay really regulated and present myself with my clients' dysregulation that is what will allow my client's nervous system to, have the opportunity to shift and change in the way that they're really longing for.
And can I ask,
Yeah.
how do you know that? Is it, or do you need to? Because what I was learning from one of your podcast episodes
Hmm.
with Bobby Badenoch, I'm always
Yeah.
worried
Bonnie
about saying that.
Badenoch. Yep.
Yes, was that you don't have to know. You can be curious. That the client has the wisdom, and I resonated with that because I practice a lot from the spirit of like MI and person centered, kind of Carl Rogers, the old school stuff.
Yeah.
But the
Totally.
spirit of
Yeah.
that is the client has the wisdom. There's dignity. They are offered dignity and autonomy by them. Is that kind of the process with this?
Absolutely. I think that, it's hard for me, obviously, somebody like me who's kind of obsessed with learning about the science does have a hard time with like, I don't have to know. That's hard for me, but actually it's the science that helps regulate me through. I don't have to know. Right. So I like to try to make sense of what's going on for me and for my clients because it helps me stay regulated. And that is what I know is ultimately the most powerful piece. But yeah, I mean, ultimately, and I talk about this with the parents I work with too. Like sometimes we just kind of have to get off what I call the trigger train and stop trying to figure out like what's going on, what's caused this trigger, why is this happening, what's it like. Sometimes we just have to rest into, I don't know what's happening or why, but I totally trust my client's inner wisdom. I totally trust my kids' inner wisdom. And I trust that even if what my client continues to do or what my child continues to do continues to be very painful, that there's something happening for them that's maybe just not ready for anything to change. They don't have enough safety to feel like change is possible. I mean, there's countless explanations for that, but ultimately it brings us back to the same place with which is I can trust. And my main job as somebody who wants to hold space for somebody else in my personal or my professional life is to be in really intimate connection with myself because we do want to get pulled into somebody else's dysregulation. That's just simply how humans work. And we want to, and then when I get pulled into their dysregulation, so what I usually want to do is fix it, stop it, make it go away. And, one of the things I think relational neuroscience really grounds into me is actually the most kind of loving, kind, respectful, generous thing I can do is to allow it. Now that's really Pollyanna-ish pie in the sky, especially because so much of my work is with parents whose kids are out of control and dangerous. So there's this idea of like, what do you mean allow it? But as the therapist, I think we have a little bit more privilege in some ways when we have these small chunks of time with people in a relatively controlled environment to really ask ourselves, can I allow what's happening next instead of try to change it? And then that opens up this, again, this beautiful way of one, trusting the client, trusting ourselves, and just kind of waiting to see what happens next, believing that what happens next is exactly what's supposed to happen next as far as that person's like neurobiology is concerned.
Mm, I love that. And it really it resonates for me too, especially with some of like my passion populations, which is families with loved ones with substance use disorder. And
Yeah.
especially as your child gets older, or as it just in general in humans, the allowing it part is becomes more painful, and also the control that you have to quote unquote allow it or not also becomes less and less.
Sure
And it's
does.
so interesting because like especially families with a child with substance use disorder, like talk about the painful experience. And I know from personal experience with my own children and also with people that I've worked with, it is absolutely, to me, one of the most painful things you can do is to sit
Yeah.
and witness that level of suffering or anxiety. And so that kind
Yeah.
of leads me to what we talk about in the field is like a special population, but like the interpersonal neurobiology, relational neuroscience with like substance use disorder or with severe
Yeah.
mental illness. Like, what does that look like? Or do you
Yeah.
have any information about that?
I have personal experience with being in a relationship with somebody with severe substance use disorder. And I think that this way of being in the world has absolutely saved our relationship for two reasons. One, it has kept me curious and out of judgment of that person's behaviors, even when they are wildly destructive. That doesn't mean I don't have boundaries around them. I can have a lot of boundaries around behavior without, while still having compassion for them. Um, it has also allowed me to, I guess, in a way, kind of have my own boundaries, like my own energetic boundaries that have kept me in a place of being able to keep showing up, not only for that person, but for myself, because being in relation, loving somebody with a substance abuse disorder is traumatic. Right. And so being able to kind of conceptualize, and I do not work with substance use disorder in professionally, somewhat because my own personal experience with it. It's just too close. So I trust other people to do that work really well. So for me, I can conceptualize that behavior as that person's absolute best way of managing their experience in that moment. That doesn't mean it's a good behavior or it's helpful in the long run, but when I shift out of kind of some of the ways we were taught to think about substance use disorders, which keeps me in a lot of judgment, really keeps me in a very power over position of that person, actually. Like something about me, like there's almost this like righteous way of like me and my coping skills way better than yours, right? Because let's be honest, we all have coping skills, right? It's just that some of us, I think in some ways got lucky enough to develop coping skills that kind of work culturally better than others, right? And so I can see this very destructive behavior, destructive for this person, devastatingly destructive for that person, destructive for the relationship, and conceptualize it as something about that behavior is that person's best choice in that moment. And I don't know about for everyone else, but for me, that just like breaks me open with compassion. That's devastating. Like that gives me a look into how painful their inner experience is and how desperate they are to get it to change and what has led them to the place where like this is their best option. Now, of course, now there's like the neurobiology of addiction and all this kind of stuff that, goes ways outside my scope of practice and things I can talk about. But for me, like framing their behavior in that way keeps me out of judgment. That actually frees me up to have way better boundaries, way better boundaries that I can make just like regulated decisions about, as opposed to like these like what end up really kind of being like punishment based decisions, like if I can punish this person, maybe they'll stop acting this way.
Which we know never works. Never
Never.
works.
Never. I mean, gosh, one of my, my lifelong journeys is this realization of how badly I want to control other people's behaviors. Yeah. I
Same.
mean, it's a thing. Thank you, bajillions of dollars in therapy for finally like being able to articulate this truth. And I'm sure my therapist was like, duh.
Right.
Like, oh gosh, I really, really wish people would just behave exactly the way that I want them to all the time. I mean, how perfectly human of me.
Yeah, I
Right?
was going to say, my guess is
Yeah.
100% you're not alone. And I think that's why this work is revolutionary to me. And I'm not as familiar with this, even though I think that I probably am in some ways from just
Oh,
the way that
absolutely.
I
Yep.
am generally, but also in loving people with substance use disorder, specifically people as my children who I like absolutely
Yeah.
love and want to help. And like also learning, part of this work was learning my patterns were not, I just would do the same thing over and over again, just the
Yeah.
same thing, which for me is lecturing and giving lots of
Yeah.
information. And like also, if you've ever tried to control a teenager,
Right.
you just
Mhm.
start to quickly recognize that like that is met with so much resistance. And so, and what was
Yeah.
revolutionary for me was to really start to drop into, okay, like I'm scared. I'm frightened. This is like, I don't want anything to happen to them. But then once I started to like learn, okay, well, this makes sense. Like, this is what's happening. The empathy for myself and others grew.
Yes.
Like, I felt like the
Yeah.
Grinch, and I didn't know I was the Grinch, but then you know how the Grinch's like heart gets all big? I was
Yeah.
like, oh my gosh. And then it
Yeah.
just, like you said, it became easier to have boundaries for myself because before I couldn't because I was just so petrified that if I did something wrong, something could
Right.
happen. But
Right.
really, in reality, like things can happen, whether you do it, whatever you do. And then, secondly, just that building the empathy. And I think that there's a lot of similarities here because
Yeah.
it's also the hardest work I've ever done. Like you just were
For
so casually
sure.
being like, I like to control. I want people to behave the way. Like most people have trouble accepting that, but like in reality, it's like it's okay.
Mhm.
It makes
Yeah.
sense, right?
Yeah, for sure. Of course. I mean, yes, yes, yes. And I talk about the parents I work with too. Is like, of course you want people to just do what you want them to do. Like my life would be infinitely easier if everybody just did what I wanted them to do. Also, it would be wildly lacking in any kind of relational richness because the differentiation of humans that allows us to not do what do what isn't what people want us to do, right? Is the tension, the separateness, which is where the relational richness exists. So yeah, I can be real flip and be like, well, if everybody would just do what I wanted them to do, I would be fine. Like I'd have no problems. Well, okay. And that would be awful as well. And I think those of us who are in relationship with folks with, really intense behaviors, whether that be from substance abuse or I talk on my podcast, my husband has a neuroimmune disorder related to chronic Lyme disease. And that was, we finally diagnosed the Lyme disease just a couple years ago. He's probably had it his whole life, not his whole life, but his whole adult life. And neuroimmune disorders impact people severely, physically and mental health. Also, often these folks have just like a list of mental health diagnoses, and it's pretty hard to be in relationship with somebody with a list of mental health diagnoses. And ultimately, now what I would know to be a neuroimmune disorder. And the number of times in the last 3 years when my husband's illness flared to the intensity that it did, which ultimately is what allowed us to get an accurate diagnosis of me like really thanking my ever lucky stars that this is what I do for a living. Like sometimes I really am like this I do this for a living. I mean, yeah, I help a lot of families and I love that work. And I used to just was like, I'm gifted at this and how cool it is that I get to help all these families. But ultimately, I'm like, oh no, I've just spent the last 20 years getting ready to help my own family through a really, really severe crisis that I think would have probably broken most marriages because we are taught, like, if somebody behaves that way, you don't tolerate it, you leave. And there's a good reason for that. I'm not saying that's terrible advice. I mean, there is certainly some behavior where the ultimate boundary is I can no longer be in this relationship anymore. And I'm very blessed that my relationship never had that level of behavior where it was just no way I can't stay anymore. But the behavior was at times, I know behavior that a lot of folks would say like, oh no, like you don't tolerate in that relationship, you leave. Okay, sure. Well, that sounds good in theory. But when it's actually your real life, you're like, well, I don't really like that option. And for me to just keep digging at what is underneath this behavior? My husband's not a jerk. He's not whatever label we want to give to him. He has a serious illness that has behavioral symptoms, which also substance abuse disorders is the same thing. Right. And so being able to keep really focused on that, one helped us stay focused on treatment that actually helps. Right. Like we're not going down the path of these behavioral treatments that couldn't possibly help because that's not what the problem was. The problem was what was happening in his brain and his nervous system. So if I stay focused on that, we can find treatment that works for him. And I can maybe sometimes a teeny tiny bit stay more present for him, stay more compassionate for him instead of being like swept away and then participating in the dysregulation, which to be clear, I also do a lot. A lot. But and then the reality is I also have plenty of very challenging behaviors. Plenty, like ones I really wouldn't love to tell you about. And we to be in relationship with somebody who can see my behaviors as not an expression of who I am, but as an expression of the state of my nervous system in that moment. Like there's hardly a greater gift somebody could give me and then I have the luxury of giving to other people. And that's what relational neuroscience has given me.
I have like at least 5 or 6 years experience in ecotherapy and practicing and
Mhm,
learning ecotherapy. And something
mhm.
that's really interesting about ecotherapy is that it's about, how like almost a lot of modalities have like a point of healing or a point of like, I call it point of contact, which theirs is healing the relationship between humans and other than human world. So
Mhm.
what we
Yeah,
have come to know as nature, but that terminology is kind of abstract. But
yeah,
that being said, something that I found profoundly life changing for me and for other people I've worked with this practice is that they are connecting with and co regulating with other than humans. So,
yeah,
with what we could say is our primary attachment, like
yeah,
primary, which is
yeah,
earth.
yeah,
And especially for someone like myself who it was so hard to build the safety to connect with humans that
yeah,
I was able to practice and learn co-regulation, connection with other than humans that felt safer for
yeah,
me. And then I could go into the human world and start to I had a little more confidence. My body, for the first time, I think ever, felt actually regulated. I didn't even know what that felt like until I spent
for
time
sure.
in the like out there connecting. So I'm curious of your thoughts on that.
So with recognizing this is like definitely outside my scope of practice or what I study, I think, yeah, I mean, a couple things are coming for mind for me. Without question, folks who have had such devastating, and maybe it doesn't even have to come from that, but just such devastating experiences with human connection need I would think of it kind of like as they need a playground of, experimenting with safe connection that isn't with humans. It's just like the safety's not possible to have, enough safety that then you can kind of like have this playground of of like, oh, it can be safe to be in connection. And I have, I think there's without question, we know a lot about like human to human connection and resonance. And but also like, yeah, we absolutely can have connection and resonance and presence with, I love how you're saying non-humans. I've actually never heard it framed that way before. So I know lots of folks who are experiencing safety and connection for the first time ever with, equines and with pets. And some of that's, traditional, like canine therapy. And some of that's not, like some of that's in their own home with their pet, right? Or just like with nature and being out and it doesn't even have to be outside. I mean, I think that's such a, again, kind of an ableist lens, is that we have to go out into nature. Like there's ways to bring nature to us that are ultimately what I would guess, again, way outside my scope of practice. I could not say, I don't know the science on this, of of like titrating the experience of connection in a way that has enough tolerable safety in it.
Yeah, that's my experience with that. And it was just valuable. And I just wanted to share that with you or the listeners and just get a sense of like that could be a way to practice this also.
Absolutely. I think that I'm really glad you brought this up, because the human relationships a privilege. First of all, something like therapy is a huge privilege, but being existing in the world in a way where you have access to safe relationship with another human, regretfully, that is a huge privilege. And I think that one of the, downsides of looking at relational neuroscience is I don't think it means this, but I think it can feel like, oh, well, if I don't have another human that I can practice being in safe relationship with, I'm screwed, right? Like I think, and I don't think that's true. And we haven't even talked about like different neurotypes and the ways that different folks experience in connection. The way I experience connection is no more better or more valid than the way somebody else experiences connection. And so I really do want to do my best to always be acknowledging that. And it's easy for me to project onto, in honestly a very loving way, this desire for folks to experience connection in like the richness way that I have been privileged to be able to. But again, it's not the right way to have connection. It's no more better or worse. And for me, that's ultimately the work is, what does it mean for you? Like you here, because we're together, but also like the proverbial you and the person that I'm with, which is, you know, we all experience these words in wildly different ways. And can I show up with you in a way that allows you to discover what connection means for you, and to not judge it, and to know that it's valid? And there may come a point where then you also go like, oh, I'd actually like to now practice connection in a different way. But that's not my goal. My goal isn't for somebody to eventually kind of come to that place. My goal is like, if they do come to that place, do they have a path?
Yeah. Yeah. Thank you for sharing that. I'm really glad that you brought up the ideas of privilege and also like that, yeah, every situation is different, every culture is different, where you live, where you practice, work, all of those type of things like come into play with this. And I think that it can be really easy to see something on Instagram or a 30-second TikTok and be like, oh, now I'm supposed to be doing, like it very much simplifies something that is not simple at all, because we're connected with with all these systems. And so that's, I think, meaningful. And I really respect that you're naming that in this setting. Probably a lot of people that that work this way are people that you've trained, or probably therapists that you might have supervised, probably are experiencing something similar. And What if anyone who's listening feels resonant right now? Like, for example, like me getting chills several times of you talking. Like, if you're noticing that, what would be some of good ways to connect? What would be some resources to start with that you would recommend?
Yeah, I think a great place for somebody who's really new to these concepts is actually Dr. Dan Siegel's audio program called the Neurobiology of We. Is easy to access, and I think it's one of his better writings as far as um, it's easy to understand if you're new to this language, the neurobiology of we. And then, the Norton Publishers has an anthology on interpersonal neurobiology, relational neuroscience. It's real easy to just go Google like Norton interpersonal neurobiology and just get so many ways to dip your toe into. And I really believe that like a great first step in practicing being in the world this way is just like seeing what kind of draws your attention, and having maybe no idea why, but like looking at a big list of resources and being like, I'm going to start with that is like the most beautiful way of trusting. Like there's a part of you that was drawn towards that. And that's what interpersonal neurobiology has taught me, that I can trust that I don't have to know why, that I can trust my inner wisdom, and I also can trust the cues that I get when I need to be more curious about it, right? When I need to be like, I wonder what's going on there. I think I need to get some consultation around that, or, get some other wisdom around that. So those are some of my favorite like interpersonal neurobiology resources. I I have my own podcast. It is definitely very much geared towards parenting kids with really dysregulated behaviors. Although I have people tell me all the time that it's super applicable, like way past that, if you're kind of listening to it through a different lens. So I think that's a great way to get, more comfortable with or more familiar with some of these concepts. I am teaching a 2-day live event in Bloomington, Indiana this summer in June. That even though my area of expertise is parenting and kids, is not a 2-day training for parenting or kids at all. It is, it's called the neurobiology of being with. So it's really about what we've been talking about the last hour is the science behind and then the practice of cultivating this way of being with ourselves, and then a way that we can offer it to our people, whether that be our clients, our partners, our children, whoever. So that'll be this summer. So yeah, I think those are some great places to get people started. A practice that's been really impactful for me is Dr. Siegel's Wheel of Awareness practice, which you can just Google, like Dr. Siegel Wheel of Awareness. And last I checked, you could like probably subscribe to his newsletter and then get his Wheel of Awareness practice as like, what you get for subscribing to his newsletter or something like that. And he talks about the Wheel of Awareness in many forms and different writings that he has, which is just this guided way of, deliberately shifting attention to what is coming into awareness. That's probably my favorite resource to direct people to. There's a lot of talk right now, important good talk about the kind of inherent or implicit ableism that comes into play with mindfulness practices. And that conversation has led me when I teach, I often do, especially when I'm teaching my year-long immersion program online, we do get started with kind of like a presence practice. Um, and I am very loosey-goosey when I lead people through that. Like I say things like, and whatever is safe and appropriate for you in this moment, allow that to come into awareness. um, Understanding that mindful presence and mindful attention and connecting with ourselves is so nourishing and something that we're not invited to do very often, but also looks wildly different for everybody. And for some folks, that might be about coming into awareness of their breath, right? In this kind of almost traditional, typical way we think about mindful presence. For other folks, it might be about noticing what's in their environment or noticing, you know, the birds outside, or just pausing for a minute and being like, oh, I hadn't even taken time to notice that, like, the sun is out. I can see the blue sky as opposed to just the drear that's typical. And inviting that truth that there's no right or wrong way to be present with yourself or with reality in any way. And we don't have to think. Yeah, I can remember doing my own mindfulness practices. I know I'm rambling at this point. This is the opposite of like a presence practice. I was that person who was like, I am doing this wrong. This is not possible. I can't possibly do this. I will. And then because of my own history, it would be like catastrophic. Like, obviously, I'm never going to be a good therapist. I probably should just quit my job and like go do something else. I'll go work at the mall. Right. Like, that is seriously what like an invitation. So, like, a moment of mindfulness could leave me with, obviously, I should quit my job and go do something else. Right. And so, like, I feel just so passionate about that. That's like, it isn't possible to do it wrong. And my way of being present with myself and your way of being present with myself can be wildly different. And I have no real opinion on that at all, except for to be intentional about carving out a moment of saying, like, whatever that's like for you in this moment, invite in some presence for yourself and what feels safe for you. It's that knowing, it's the self knowing and the self trust that matters, not the paying attention to your breath.
I love that. And I'm really glad you brought that up because I think that it is being talked about. And also like there's so many layers to talking about mindfulness, especially like cultural appropriation and like that it's a
Yep.
spiritual practice. But I like the idea that you're saying like being with yourself. I guess that could be called mindfulness, but it doesn't have to be. And I think there's been certain stages where my nervous system, and depending on what's going on in my environment, where I cannot sometimes tolerate focusing on my breath or my body. It's just too terrifying because it's actually not safe in that moment for me to like
Right.
focus on my breath. Like I need to do something else in order to give my nervous system what it needs, or my body. And so I'm really glad that you brought that up. And I think that's something that's so freeing to kind of offer yourself of like, there's no right or wrong way to be with yourself in this moment, and to like give that moment of paying attention and whatever paying attention looks like. And it's not always pleasant, is it now? And I think that's something that I've worked a lot with my clients. So they're like, meditation sucks. Like, I don't feel good right now. I mean, isn't this supposed to make me feel better, or whatever the word they're using? And I'm like, well, I don't think it's, for me, my sense
Right.
is it's more just about noticing what you notice. And like, we don't always feel great. And then of course we could get into a whole soapbox about like toxic positivity and this like maniacal quest for happiness, and that
For
I think is
sure.
actually damaging to a lot of people, because
Very
the
much.
idea that that's supposed to be the case, it makes me so sad because that's not human experience necessarily. And I think it causes a lot more pain and resistance if we think that what's happening is so wrong within us,
Yeah.
rather than just, wow, like we're humans and we've evolved these like emotional responses to things, and
Yeah.
they're going to show up. Like that
Yes.
makes me feel so much more at ease when something that's showing up hurts, is
Yeah.
scary. I don't love it, you know?
Yeah. Yeah.
So I really appreciate you bringing that up.
Yeah. I mean, there's just no goal, right? There's no goal, period. Right. Like, I wouldn't even say the goal is to be more present with uncomfortable feelings. Like, whatever. I mean, maybe the goal is to notice that it feels like crap. And so you're not going to pay attention to it anymore. Like,
Yeah.
the goal, if there's a goal, is like, there's nothing wrong with you. There's nothing wrong with your moment and how it's unfolding. And I don't get to have a judgment on it or an agenda for what that moment looks like for you.
Okay, mic drop. we can end it here. Is there anything else on your heart that you want to share with our listeners today? Obviously, well, I'm going to put everything in the notes. So links to how to like reach out, like how to get in touch with you or how to learn your work and other resources you mentioned. But yeah, is there just anything else that you notice wanting to be said or shared before we close?
What I'm noticing right now is just lots of gratitude, for you, for like the opportunity today to like get to meet somebody new, and also this experience of what happens for me when it's like there's so many people on this journey out there doing this work, doing it in lots of different ways. And some of us do it like this, right? Like with microphones and with platforms. And that's not a better way to do it than anyone else and how they're doing it. It's just another way, and it's an important way. And to be able to have all these cool opportunities to connect with folks, right? Like I'm imagining like who's going to listen to this? That is so cool. So thank you for that.
Thank you. I appreciate you acknowledging that because it really is. And sometimes it can be hard because we're staring at each other through screens and speaking into some kind of like unknown void, but really there will be connection in that way. And that's really cool to think about. Thank you so much. I appreciate you. I had fun.
I appreciate you.
I can't wait for your 2-day training.
I know, me either. It is going to be really fun. So
right
it'll
on.
be great to meet in person.
Yes. Peace. Thank you so much.
Thank you.
Thank you so much for joining us for today's conversation. Hope that you got a lot out of it, resources, information, and maybe even some new perspectives that you can take with you in your personal and professional development. Please rate, review, however you do, in whatever platform you choose. It would really help get this information to mental health professionals if it's something that they're interested in. So we really appreciate it. And we hope to hear from you soon. What topics are you interested in? What would you like to hear more about? We would love to connect. So please check out our website, www.academyimh.com. And there you will find all the information needed to connect with us in various ways. Peace.